Mental Maps is brought to you by Well. Well is a virtual holistic mental health service providing psychiatric evaluations, holistic interventions, and when needed, medication management. For more information, check out Well at www.arukawell.co. That's www.arukawell.co. Welcome back to Mental Maps. As always, I hope this finds you well no matter what season of life you're in. Today, I'm honored to be joined by Dr. David Bilstrom. David, welcome.
Oh, my pleasure. Nice to have.
I
Nice to
love
be.
if you're watching this on YouTube, you see David, he's got this beautiful background going on. He's this digital nomad provider now. And so you got to tell us, what is this about? How did you create this?
Well, I've been in private practice in the past. And then as part of my desire to change the way that autoimmune disease is dealt with worldwide, I got back into the hospital system, was there for 10 years. And then I'm back in private practice now since the summer of 2025. And 100% virtual concierge medicine practice.
Yes.
And I get to do all my clinical work outside. And so my wife and I were just kind of checking out different places. Currently, I'm just north of Tucson, Arizona. Sun's coming up over the Catalina Mountains. This is where I do all my clinical work.
That's beautiful. That's so healing, right? Healing for you. And I'm sure it creates a better opportunity for you to meet with your people. I love that, man. That is great. And I think let's just kind of jump into it, right? I mean, your work has focused so much on the concepts of autoimmune disorders. And so if you listen to this show, you may be thinking, well, how does autoimmune disorders ingrain with mental health? And I think that's what you're going to show us today is there's a lot of connection between these two disorders. So I think as we start, just what does it even mean to have an autoimmune disorder? Like, what is that?
Well, I'm very fortunate that when I decided that somebody needed to actually change the way autoimmune disease is dealt with worldwide, there was all the classic autoimmune diseases like rheumatoid arthritis, juvenile rheumatoid arthritis, multiple sclerosis involving the brain, psoriasis, the skin, all these different autoimmune things. So the classic thing is the part of the immune system called the adaptive immune system, where the immune system will make antibodies specifically to go against a certain protein, a certain something. Now, historically, that would be like an infection. Like the cold virus gets in us, we feel really crummy. We don't need this for 20 years. So the adaptive immune system makes antibodies specifically to kill the cold virus. So hopefully we feel better within 4 to 5 days. But a bunch of set of circumstances will occur where we'll actually start making antibodies attacking our own body parts.
Yeah.
And truly, even though there's like hundreds of different names for autoimmune diseases, there's really one disease that can attack any body part. And so this is one reason why it's so easy if you get one autoimmune disease, but you don't get rid of the autoimmune disease and fix why you got the first one. Well, you get a second one, a third one, a fourth one. I've seen 8-year-olds with 4 autoimmune diseases, women in their 20s with 8. It's just like boop, 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 boop. But in the last 10 to 15 years, we're really realizing that the other part of the immune system called the innate immune system that oversees inflammation and inflammation control, so you don't get excessive inflammation, is actually a huge part of this autoimmune kind of thing, where the innate immune system that ideally, for the most part, is supposed to make sure we don't get excessive inflammation, because any body part that has excessive inflammation will get dinged, and then you have a health problem in that body part, including the brain. But it'll actually make excessive inflammation, damaging tissue. And this is where, as I've been doing this, I'm like, well, this is so cool. I didn't see this coming. But this is where autoimmune disease and immune system disruption is tied into all chronic disease, not just the traditional ones, but it's tied into autism. 70% of all autism is one particular autoimmune disease. Every other neurologic issue in childhood that's not quite autism is tied into this autoimmune stuff. But also, here's heart attacks as part of this, and strokes, and Alzheimer's, and dementia, and Parkinson's, and osteoporosis. And you're like, this is so cool. This is actually part of all chronic health issues. But it's really nice because now we're going like, well, geez, all the things that we're doing to prevent and reverse autoimmune disease will prevent and reverse all chronic disease, including
Mm.
cancer is the flip side of the same coin, this autoimmune disease. So anything you do to prevent and reverse autoimmune disease is preventing and reversing the chance of cancer, getting cancer a second or a third time. Just like everything you do to prevent cancer, get rid of the reason why somebody got cancer, so don't get it again and again.
Mhm.
You're actually doing your due diligence to prevent autoimmune disease as well.
Wow. Okay. And so I think for the people who may not be in the medical space, and that is perfectly fine. You're always welcome in this space too. What you're kind of saying here is that there'll be some kind of trigger, and within that trigger, your body will then start attack itself, right? And at one time, we think that when you hear of an autoimmune disorder, you have a family member, or maybe you yourself are experiencing that. You kind of view it as like, okay, my body is attacking this one space of me. But you're saying that because of the way the immunity works in our body, our immune system itself, it's systemic. And when one
Yes.
occurs, numerous can occur. And so then you mentioned the concept of autism. And so I know that's a huge hot topic right now, and so many concepts of mental health and neurology and pediatrics. Can you speak more about that? How does this world of the body attacking itself correlate with autism?
Yeah. So, when the body's attacking itself, basically we're self destructing. And if you want to maintain health, the last thing you want to do is start self destructing. Super counterproductive
Yeah.
to maintain health if you're self destructing, right?
Mhm.
And so, autism is a fascinating one for me because even though all autoimmune disease is really one disease that can attack any body part, every one sort of has a unique kind of funky, cool, common, a little different thing. And so, 70% of all autism is an autoimmune disease they call folate receptor alpha autoimmune disease. So, folate is folic acid, one of the B vitamins. And what tends to happen now, this can be passed down from generation to generation. So, parents can have antibodies attacking folate receptor alpha in the brain, receptors for folic acid in the brain. And most people kind of know that the B vitamins are very important for brain function,
Mhm.
but also very important for a lot of things. So antibodies attack the receptors for folic acid in the brain, knock out the receptors for folic acid. You can have all the folic acid in the world. It can't find a place to attach to do its work.
Mm.
Brain suffers tremendously. So parents can have this. And if both parents have this, it can kind of get passed on to the child. One parent, not the other, gets passed on. But even without parents having this autoimmune thing that gets passed on, you can develop independently once you introduce animal milk proteins to the diet. Cow and camel are the two worst, goat and sheep are next worst. And so what happens is these animal milk proteins are introduced to the body. And just like the immune system has to do for everything, something enters the body from the outside world, the immune system has to decide if it's friend or foe. Is this my friend and I'm going to let it in willingly, or is it my foe, like an infection, let's say, and I need to kill that thing? Okay. Now we kind of go, well, food is food, right? But truly, animal milk proteins, they get in us. The human body realizes, well, that's not human. It's not us. It could be our enemy. It has to
Mm.
kind of figure out, well, is it actually acceptable to get something in that's not us already? Infection, food. Okay, I can tell the difference, ideally. So they get in, but these proteins in these animal milk proteins are about 94% similar to the proteins in the folic acid receptors in the brain. And for a variety of reasons, the same thing that drive all autoimmune disease, all chronic disease, the body can get kind of confused, for easy way to think of it. And it goes, well, geez, this protein, I think it might be my enemy, actually. I don't think it's a friend, it's
Mm.
an enemy. Well, if it's my enemy, I need to attack it and get rid of it. Make antibodies attack this food sensitivities develop and things like this. But also it goes, well, geez, those proteins up there in the brain kind of look exactly the same. I better attack those guys too. Right?
Mm.
And so it knocks out all the
Mm.
receptors. So the classic thing with this one that I think is so cool is you go animal milk free diet. And ideally within 3 to 13 months, the immune system stops making antibodies against those proteins and against the folic acid receptors in the brain. Then you got to make sure the body has plenty of folic acid in the usable active form. B vitamins that we get from our food tend not to be usable active form. They have to be methylated. Now, they could also be phosphorylated to make them active. And so I use a prescription medicine. There's prescription medicines for these kind of things, which a lot of people don't understand, called leucovorin. And leucovorin is a phosphorylated form of folic acid that's usable.
Mm.
Okay, so now you got to get it from the bloodstream because you just swallowed this leucovorin, this folic acid, into the brain. Well, it's got to cross the blood-brain barrier. And the blood-brain barrier is very selective on what it's going to allow into the brain. Because this is where a lot of brain stuff happens. The blood-brain barrier gets broken down, and things get in that shouldn't get in and mess the brain up. So it turns out, and this is when I think I wrote a blog post that says vitamin D does it again about this concept, because in order to get the folic acid in a usable form across the blood-brain barrier, it turns out the carrier molecules are vitamin D dependent. So you have vitamin D at the right amounts, perfect amount, ideally like 90 to 100 on a blood test, to get it to the brain where it can do the work. And then you start reversing this whole process. Now, I think it's really neat that some traditional pediatric neurologists, the last 2 years, I started seeing people come to me that had already been put on leucovorin by their pediatric neurologist. And I'm like, oh, that is so cool. They're starting to understand this better, right? I use like 25 milligrams twice a day in children. Big studies, 5 to 8-year-olds, totally fine, no side effects. This is the therapeutic value. I'll start seeing a couple of children coming on 100 milligrams a day from pediatric neurologists. And I'm like, oh, that's so cool that they're first time I've seen them use this. But I'm also like, oh, 100 milligrams, there must be something that they've heard that they use those higher doses. But almost universally, the child's no better. And that's why they came to me, right? So I go, okay, this is so cool. Talk to the parents. And I'm like, so are you guys using vitamin D? Oh, no, we're not using any vitamin D. I go, oh, I bet you I know why it's not working. So we put them on vitamin D. They start changing. They
Wow. And when you
just couldn't
say
get
they,
across the blood-brain barrier.
wow. And before we even jump, because I want to riff on this for a little bit. Before we jump into that, when you say changing, what are you noticing? What gets better? The symptomology you're seeing there.
Yeah, all the stuff. So I try to do as best I can, have the parents or any patient, right, tell me everything that is bugging them, because everything's connected,
Mhm.
right? And by all these really big central mechanisms that either drive disease or drive health. And so I want you to tell me about everything. Tell me about your brain stuff. Tell me about your skin stuff, your poop and stuff, your joint stuff, your muscle stuff, your, whatever stuff that's not right, it's connected with these central mechanisms. So on the parents, I'll try to get them to tell me all the things they're noticing about their child with mental health issues, autism included. And, oh, and I quote them, more irritable than the appropriate. Give me that to me 1 to 10. Unable to focus, 1 to 10. Um, anything they can come up with that describes their child, let's say, 1 to 10. And then when we talk the next time, I go, okay, so you said I quoted you 1 to 10. You gave it a 9. What do you think you give it now? I probably give it a 2 to 3 already. Okay, fantastic. We'll go to the next one. And so we just go across the board. Now, some things might change quicker than others, but ideally, because everything's connected, everything that is not quite right should get better over time. But the body tends to have its own priority list. We may say, well, this is the biggest problem for me. But the body and the brain go, well, actually, this is my priority. I want to fix this first. And we go, okay, cool. Let's fix that first. But it's going to get to all the other stuff as time goes on.
Wow, that's so interesting. And I love how you talk about how the body decides what needs to be fixed first. I think so many times we see people who they're coming in, they're like, all these things are going on. I want all these things fixed. Why is this not getting better? And there's a process to it, right? And the body's getting better, what needs to be better. But you spoke about these B vitamins, and I think there's been a huge discussion of B vitamins, especially B12 and B6, but across the whole B
Yeah.
gamut for brain health. And within that, you mentioned that a lot of our foods are missing those active forms. And so in your experience and being in the medical world for as long as you have, how did that happen? Like this, I mean, it wasn't like all of a sudden like B vitamins just started being bad, right? Like how did that go down?
Well, part of it is the standard American diet, the SAD diet, right? So aptly
Mhm.
named the SAD diet because most foods, the highly processed ones and all this, they have no nutrient content,
Mm.
right? They're full of
Yeah.
toxins as well.
Yeah.
And so they don't even have the nutrients. But even if you're eating foods that have are nutrient dense, like ones that have a lot of B vitamins, typically the B vitamins in our food is not in an activated, methylated, usable form.
Mhm.
So when you have to have a healthy enough gut to absorb the nutrients from these
Mhm.
nutrient dense foods into the body, but then with the B vitamins, you have to methylate them. And we
Mhm.
don't tend to be great methylators. There's a whole bunch of different
Yes.
reasons why we can't methylate things, including B vitamins. Now, people hear a lot about, oh, MTHFR gene SNPs that
Yeah,
make
speak to
me
that.
the bad methylator. And they say, well, can we order that? I go, well, we could. I don't tend to order it because, that might be one way one reason you're a bad methylator, but there's probably like 20 ways. And
Mm.
we know through epigenetics that you may have a bad gene, but we should be able to turn it off anyway. Now, if you have a good
Mm.
gene, turn it off, you can turn it on too. That's kind of another little subject there.
Yeah.
So we just got to make sure that you can methylate your bees well, but we don't tend to eat a lot of foods with high methyl groups, such as the cruciferous vegetables like broccoli, cauliflower, kale, those kind of things have high methyl groups to allow us to methylate B vitamins. So now they're in the active usable form. And
Mm.
I talk about this in my book, in my textbook chapter a lot, and all the scientific references are lined up whoop, on those things. So there's a blood test called homocysteine.
Mhm.
And ideally, the level is supposed to be 5 to 7 on the blood test. It'll go up if we don't have B vitamins in an active usable form to do work. And when homocysteine increases, it drives inflammation. And it basically is pushing people to everything you don't want, right?
Mhm.
Because if you are driving inflammation, every body part's going to be dragged down. And this would include high homocysteine levels been associated with increased risk of mood issues and Alzheimer's, tough on the brain, heart attacks and strokes, cataracts, macular degeneration, diabetes, autoimmune disease, cancer, osteoporosis. It's like, holy cow, without
Mhm.
B vitamins in an active usable form, here comes homocysteine, here comes inflammation, here comes chronic disease. And so, utilizing therapeutically a fully methylated B vitamins is really important for turning on chronic disease. Now, the one I like is not just every B vitamin is methylated, like methylcobalamin, the methylated form of B12, for example,
Yes. Yes.
but it includes something called trimethylglycine.
Mm.
Uh, and trimethylglycine, as the name suggested, has 3 methyl groups, and it's an excellent methyl donor. And so I like the B vitamins that have this trimethylglycine in it so that you can donate methyl groups to the person so they can methylate their own B vitamins on top of it once
Mm.
they're getting into the
Mhm.
food. But also, and this kind of ties in all this brain stuff, is if you're going to get rid of toxins from the body, you have to methylate toxins to get
Ooh.
them out.
Yeah.
Really
Mhm.
big detox. Boy, the brain is so sensitive to toxicity, right? Now, you also have to methylate our genes, our DNA. The genes being long chains, make up the DNA, tell the cells what to do. So it turns out it's not so much what genes we have, it's which ones get turned on and turned off. So this is epigenetics, the things that
Mhm.
alter gene expression without changing the genetic code itself. So it turns out that all of us have tons of terrible genes. We all have tons of good genes. But if we're not feeling well, it's because you're turning on the bad and turning off the good, kind of every
Mhm.
cell in the body. It's so easy to get one thing after another after another. And a big way to flip the genes the correct way is through methylation reactions. You got to
Okay.
methylate. So you're like, man, these methyl groups are so important for all this kind of stuff, including when it comes to this autism stuff. So then now the folic acid receptors are waking up. Now the leucovorin you're using can really do more and more work as time goes on because they're actually have receptors that are awake to do it. And then all this neurologic stuff can reverse, but you've also done a huge amount through like vitamin D and activated B vitamins already
Mhm.
for a lot of other health issues, kind of putting you in a position not to keep getting new stuff anymore, along with getting rid of the stuff you already had established.
Mhm. I think that is so interesting. I think that's so important for everyone to hear. I've worked with so many parents who, they go out and they spend their hard-earned money on some vitamins, right? And they're like, "This is what's going to help my kid. This is it." And then they get something online or TikTok or whatever, and they go pick it up. And I think you did a great job of being able to say that just because you're taking the vitamin doesn't mean it's going to work, right? And within that, is the form even active? And what does that look like? And do you even have the ability to activate it, right? There's so much more than just take your vitamin and everything's going to be okay. And so I think that's a really great point. So if you have like someone out there who, they're a parent, they're trying to figure out what, or even maybe themselves are like, what vitamin do I need? You're saying ensuring that it's methylated. And how can they ensure that? You talked about different methylations. How can the regular person access that out there in the market?
Well, you're going to have to get something online. If you go to
Yeah.
your local store, even your health store, they just don't have the good stuff.
Mhm.
And they're full of fillers that you probably don't want to use anyway.
Right.
Kind of a thing that can be counterproductive with this kind of stuff, including they'll throw things in that are inherently, we know, are bad for people and cause problems
Mhm.
when they have these health
Mhm.
issues. Like they'll throw like gluten in there, and they'll
Yeah.
throw dairy,
Mhm.
cosmic dairy products in there and those kind of things. It's like, well, that's the last thing you want to put into a supplement for somebody that already has health issues, because those are probably bugging them already because of these
Yeah.
health issues. And so you got to get it online. And, but yeah, so, we just have a country of messed up guts. Right. And so
Mhm.
even if you're using a high quality one, it may be hard to absorb it into the
Mhm.
bloodstream and get the bang for
Mhm.
your effort as well. But then with this, if you don't mind, so here's this folic acid receptor autoimmune disease. And one of the articles that I quote a lot and on my slides, my lecture, the name of the article includes these words: treatment, prevention, and diagnosis. I go, that is so cool. We can treat it, prevent it, and diagnose it. It's in the title, but people don't know that, right? But it's in the
Mm.
title of this. So the overlapping neurologic issue of childhood is kind of like every other neurologic issue you can think about that's not exactly autism, even though the two groups overlap, where both groups can get seizures and migraines,
Mhm.
is kind of everything else. It's called cerebral folate deficiency syndrome. Folate being folic acid again, cerebral being brain. And so it's kind of like, geez, at 4 months of age, my child became more irritable and wasn't sleeping quite as good. My child's muscles might be too tight or too loose. They could have little muscle cramps. They could have little muscle twitches. They can have not the greatest coordination. I come from Chicago originally, and you're like, well, not everybody can be Michael Jordan, but a lack of coordination could be this neurologic thing. Your child
Mhm.
could be a whole lot more coordinated if you didn't
Mhm.
have this neurologic thing. And then things like the cutest little children with glasses, neurologic, cutest little children with hearing aids, neurologic, all these different kind of things are overlapping with these two things, but they're kind of the same thing, just show up in different people, different ways. And so, all this epidemic of neurologic issues in childhood is kind of like, well, if it's not autism, it's developmental delay. Well, if it's not that, it's ADD or ADHD. Well, if it's not that, it's anxiety, depression. Well, it's not that, it's migraines and seizures. It's like, what I find interesting in the brain, whether it's children or adults, kind of like this autoimmune thing. It's only one disease, can attack any body part, show up in different people, different ways. So
Mhm.
I look at the brain kind of like, well, any brainy thing is just a brainy thing. Doesn't really matter what name you put on it. It's just a brainy thing. And then you go back and go, okay, what's causing this brainy thing? Including, I thought this was pretty cool, is in functional MRI scans that look at the function of the brain. The one part of the brain, the function is off, that drives major depressive disorder. It also drives schizophrenia.
Mhm.
Same brain part showing up in different people, different ways. And so it's like, okay, it's all brainy stuff. But then it goes back to, okay, what's causing the brainy stuff?
Mhm.
And, I'm probably not telling anybody something they don't already know is the gut. So like if you have any kind
Mhm.
of brainy thing, the first thing you should think about what's going on with the gut. It's
Okay.
just a super tight gut brain connection, which
Mhm.
of course, because you talk about that all the time on your podcast.
Yeah, and I think that that's such a great point to put out, right? Is that one, getting really good vitamins, ensuring that you're getting them methylated, being able to get them into the brain is super duper important. But no matter what, when we think about brainy things, right? And we talk a lot about it on the show, of course, there's been a gamut of triggers in your life, right? Whether it's childhood illness, whether it's trauma, whether it's stress, or whatever those things are that's kind of triggered these things that are happening in your body. But like you said, it's the same thing that's just showing up in different ways. And many times what happens to us, especially in psychiatry, is we spend a lot of time on like what I call the phase three, right? The neurotransmitter problems, but we're never spending a lot of time on like, why are the neurotransmitters messed up anyways? And so you're
Yeah.
saying that it has a lot to do with some of these genes. And I think I would love for you to talk about the concept of turning genes on and off, because I think there's a huge discussion now of 30 genes are impacted in this or 100 genes are impacted in this, but you're saying these can be turned on and off, and that's really important. So what does that mean, and how can someone maybe leverage that for their health?
Yeah, so it kind of goes back to when they decided to do the Human Genome Project, and they were going to
Mhm,
sequence the human genome, thinking that, well, we're going to find every gene that creates every disease, and we can go in and zap it, and that disease is gone in every individual. Well, they got done, and they're like, well, here's this really rare 50 people in the world genetic thing. We can zap that gene. But really, it's actually not what genes you have, it's which ones get turned on and turned off. This is this
mhm,
epigenetic thing. And so anything that the body can do that works through epigenetics is going to basically be able to fix everything at the same time. Anything we can do to help heal that works through epigenetics is going to help everything heal in the same place. But you kind of go, okay, so this is how we get these diseases, and it's one thing after another when you get this epigenetic hit. But where does it come from? Well, um, it actually gets passed down from generation to generation. So this is part of this generational trauma stuff that we hear so much about.
mhm,
Now, of course, you kind of alluded to it, like adverse childhood events. These things like divorce, separation, incarceration, substance abuse, physical, verbal, sexual abuse, trauma, all these kind of things that happen, adverse childhood events, alter epigenetics, creating profound increased risk of disease both in childhood and decades later. But it actually gets passed down from generation to generation. So we're actually the product of epigenetic changes in the previous 6 to 8 generations.
mm, mm,
And so in previous generations, they had trauma, let's say, epigenetics were shifted incorrectly. Well, if they didn't do something to flip them before they conceived the child, the epigenetic hit is passed from generation to generation. It can kind of gather speed as time goes on, right? Like this hit, this hit didn't get corrected. Now, here's our children nowadays. You're like, holy cow, where's all this stuff coming from? This
yeah,
it didn't used to have all these issues, right? And it's all the brain stuff. But I also remember I grew up in Chicago, so every school I ever went to was really big. So like my
mhm,
grade school was like three stories high. There was
wow,
one child carrying an inhaler around because of asthma. That one kid, and everybody knew who that one child was. And everybody's like,
yeah,
"Oh, that's kind of weird," you know. And I was like, what child isn't carrying an inhaler or have a peanut allergy or a gluten issue or has, all that kind of stuff, including autism. Every time I lecture, I got to check the new data on how often it happens because every year it's like more and more and more. Like
mhm,
3 years ago, I gave a lecture to nurse practitioner conference in Arizona, and it was worldwide 1 in 162, but I think in the US at that point, it was like 1 to 64. Well,
wow,
then I just gave a lecture like last week to doctoral nursing practitioner students at Montana State University. And I go, okay, let me check this. And it's like worldwide, it's under 1 in 100 now. And the only country that is still 1 in 100, every other country is more often, is Sweden, is 1 in 100. Every other country outside the US is even more common than 1 in 100, which is so different than 3 years ago. And now here in the US, we're like 1 in 32
mm,
compared to 1 in 64. And so it's just more and more stuff. Well, this is this epigenetic hit, right? This
mhm,
gets passed on from generation to generation.
mhm,
So a little bit, I think, to your point, is I don't really check genes. Go, all this really cool test nowadays. What genes do you have? Well, everybody's got a bunch of crappy ones. Everybody's got a bunch of good ones. I see the report. I go, well, send me the report you had done. I go, yeah, there's a lot of crappy ones. Yep, there's a lot of good ones over there. but you've turned on the bad ones and turned off the good ones. But things like Harvard, before we got online here, you kind of mentioned some Harvard researchers that you tend to enjoy. And Harvard did this great study back, gosh, I think it's like 16 years ago now, where 2 previous studies, the second one in India, suggested that meditation works through epigenetics. And so Harvard said, well, this is really fascinating. We're Harvard. We're going to do the quintessential study, put our best researcher on it, and we're going to see if this is actually true. Excuse me, I'm scooching, so I stay in the shade here. The sun's moving a little bit over the mountains. So they took this huge group of people that had done some kind of meditation, so like meditation, deep breathing, repetitive prayer, progressive muscle relaxation, yoga, tai chi, qigong, all these different forms of like meditative stuff for between 3 and 27 years. They took all these other group of people that never done this stuff, and they checked their epigenetics, and there was 2,000 genes that were expressed differently between the 2 groups. And they said, well, that's really cool. Okay, so now what we're going to do is teach this new group called the new meditators how to meditate. And we're going to ask them to do 30 minutes, 5 days a week for 8 weeks. And then we're going to retest them. Well, after the 8 weeks, of the 2,000 genes that were expressed differently initially, in the new meditators, 400 genes had flipped their expression to match the long-term meditators. And they go, that's cool. What do those genes do? They go, well, this is really cool. They code for inflammation. So they're actually flipping the genes the right way to get rid of excessive inflammation.
Yeah.
And they said, that's really cool. And I said, well, that is really cool, but I kind of expected it because they'd already showed that with acupuncture. They'd already kind of showed that with some other things. And so it wasn't like a big leap for somebody like a functional medicine person, maybe, because we kind of expected that, right? And they go, well, this is why meditation works for everything. Okay. Now, I always and we're taught in training that you look at the conclusions of scientific articles. We always got to look at the meat, because sometimes the meat will tell you more than the conclusion. And sometimes the conclusion isn't supported by the meat, but sometimes the meat is like, wow, that is even cooler than the conclusion. So what I thought was significant, it only took 8 weeks. It wasn't like you had to do this stuff for like 2 years, 5 years to get the bang. It's like 8 weeks, right? The body's so smart. It starts flipping stuff fast when you give it the opportunity. But also, I think it speaks a lot to human nature. And what I like to say a lot is, well, you never need to be perfect to turn this stuff around, just perfect enough. So here's Harvard. They asked these new meditators, give us 8 weeks of your life, 30 minutes a day, 5 days a week, just for 8 weeks. On average, the people did it 15 minutes a day, 3 days a week. Harvard can't even get people to do it like you should. So, like, who am I to ask my folks to get like, well, you didn't do it 30 minutes. You only did 15. Like, well, of course, humans are imperfect beings. They're not going to do it perfect. But that's all. It's just a little bit for a short period of time starts flipping this kind of stuff. And so this is where like when the body, such as the good bacteria in the gut or the liver, can't make things that work through epigenetics, I can use those things as supplements to start flipping all this stuff. And at the same time, fixing why they can't do this stuff so they can actually start making their own stuff again that actually works through epigenetics and does all this other cool stuff, including super tied into this epidemic of brain stuff, where who doesn't have a brain thing nowadays? People are getting dementia and Alzheimer's in their 50s, and it's crazy, crazy, crazy. And the stuff that, can I go back to the gut just real quick? Is that okay? The intestinal.
Yeah, let's hear it. Yeah, right on.
So the good bacteria is supposed to make a ton of stuff.
Yeah.
You kind of referenced serotonin. It makes dopamine. Actually 95% of all serotonin is made in the gut, even though we tend to think of it as a very important thing for the brain, right? And everybody's on selective serotonin reuptake inhibitors to make the body think it has more serotonin than it really does. And a lot of people say, well, geez, that feels a lot better. But it always begs the question, why do I need a medicine to make my brain think I got more serotonin than I really do? Why am I not making enough already? Well, if you know that 95% of it's made by the good bacteria in the gut, you go, it's a gut issue. Well, 50% of all dopamine, motivation to do stuff and pleasure in my activities, but also concentration and focus and kidney health, dopamine, 50% is made in the gut. The gut makes GABA, the calming neurotransmitter, which is so cool. But the gut also makes things called short chain fatty acids. And actually, short chain fatty acids are typically tested on the digestive stool analyses the functional medicine people run nowadays. And one of the biggest ones is butyrate. And so butyrate's made by the good bacteria in the gut. Well, butyrate almost exclusively works through epigenetics. And this is why it can fix everything or keep us healthy, keep us healthy. It actually prevents and kills cancer cells 5 different ways. It actually prevents osteoporosis. It actually will help children with cystic fibrosis who are drowning on their own lung secretions. It helps brains recover after strokes. It does all this really cool stuff because it works almost exclusively through epigenetics. And so I use it as a supplement in children and adults to fix the system epigenetically and do this other kind of stuff. There's something the liver makes called TUDCA, all caps, TUDCA. And the liver gets dinged with all the stuff we're going on, including when we're born, the liver's not fully formed and functional till 8 months of age. So it's kind of been a little dicey situation. Okay, a little susceptible to a ding. So a child who has jaundice around the time they're born, which happens a lot nowadays, dings the liver. Bilirubin's released, liver got dinged. That child has a 25% increased risk of type 1 diabetes because TUDCA production goes down. That makes it really hard for the pancreas to make insulin, and children end up with insulin pumps and insulin shots. A preterm infant born before 37, 36 weeks, which happens a lot nowadays, right? Liver gets dinged, profound increased risk of type 1 diabetes. But because the lack of TUDCA production from the liver is so bad, not only does it make it more like a type 1 diabetes, but type 2 diabetes 4 decades, 5 decades later, and all this other kind of stuff, right? And so TUDCA works through epigenetics, which is really cool.
Yeah.
You know, people might be saying, well, there's nothing cooler than that. And I go, well, as a third thing it does, which is kind of cool too, it actually kills cancer cells. That's kind of cool too. But even more than epigenetics with this TUDCA, they call it a chaperone molecule. And this might be the coolest thing of all of this TUDCA, which is pretty cool considering that epigenetics is pretty cool already. So the reason I call it the chaperone molecule is that 80% of us is protein. If you take away the water in us, we're 80% protein. So all the hormones are protein. You know, cell walls have protein. The bone is 80% collagen protein, 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 protein. So we have to make healthy new proteins all the time to replace damaged proteins. So it's done in one particular part of the cell called the endoplasmic reticulum. We live in a crazy hard world to be healthy. Toxicity and stress and nutrient deficiencies and all these kind of things. It creates inflammation within the endoplasmic reticulum, causing endoplasmic reticulum stress. And then what happens is a misfolded protein response. So they're trying to make healthy new proteins, these long chains of amino acids right here. They get misfolded. And now instead of a nice, beautiful protein to do work, it's a big glop of amino acids that then gunk up that part of the cell. And then you get more misfolding and then more misfolding and more misfolding. So this TUDCA is called the chaperone molecule because it chaperones proteins through the production process so they do not get misfolded. And this is why this lack of TUDCA production, this is where, you know, children, preterm babies and other kind of stuff, but toxins nail the liver too, right? All the stuff that nails the liver. We have all these civilization diseases. So this lack of TUDCA production is a central mechanism in all the civilization diseases, all these things that are much more common than they used to be. All the childhood stuff we talked about, dementia, Alzheimer's, Parkinson's in adults, but also heart attacks and strokes. Guys are getting heart attacks in their 20s. Cancer. Women get breast cancer in their 20s and 30s, and over 100,000 women, when they're diagnosed, already have metastatic breast cancer every year in the United States. Early detection is not the key. When over 100,000 women are already metastatic at diagnosis, and including 20-year-olds, here's cataracts and macular degeneration, here's osteoporosis, here's type 1 and type 2 diabetes, all this kind of stuff. And so you see these central mechanisms, all this brain stuff, cardiovascular, cancer, all this kind of stuff, because the liver can't make this important thing. And so I use it a lot, as you can imagine, as a supplement to fix the entire system.
Mhm.
Now, the liver's trying to make TUDCA for itself so it can make a lot of important things we need, including like glutathione, which people talk about as such a big one to keep away excessive inflammation, but it's trying to make a lot of other things. Well, if it can't make enough TUDCA for itself, it won't make a lot of these other stuff like glutathione. But if it can't make enough for itself, it's not making enough for these other body parts. You can give
Mhm.
it. Now everybody's getting happier. Eventually, the liver gets so happy it can make the TUDCA on its own, and you don't even need the TUDCA as a supplement. Or you fix the gut microbiome. Now you got butyrate producing good bacteria again. You don't need to take butyrate. And then you've done your due diligence to kind of get rid of all this stuff, including all this brainy stuff. It's all tied in the brain. And then you lock somebody in place, including epigenetically, and that ideally then puts a person in a position to stay healthy their whole life.
And I think that brings up a great point. Is you're saying these interventions that you're bringing in, these genes are turning on, and as these genes turn on, it creates this gamut of issues, right? And this is one of the reasons why we see so many mental health conditions align with other like problems, right? At the
Yeah.
same time, you talk about it's so important to know the whole timeline. I tell my students all the time, do a timeline with people, know what it was like. There's so many things that we gloss over that happen to us physically, mentally, psycho, all the things that we're like, oh, it wasn't that bad. They kind of set us up for this stuff you're talking about. So knowing that is so important. But what you're saying is that if you can intervene, not only will you prevent, but you can heal and come off some of this stuff, right? Because your body should be able to take this over. And so I would say, I would wonder, I'm sure many people that are listening to this, they may be saying like, where do I start? Like, how do I make my genes better? Like what can they do to kind of get on this journey of healing the coding that makes them who they are?
Yeah. And thank you. Because that is the $1 million question is, well, here we're talking about all these really cool central mechanisms that they
Mhm.
oversee everything, right? Whether it's meditation or other kind of stuff. Well, where's a good place to start? Well, um, I think a lot of people know how important vitamin D is, but I think almost everybody underestimates how great it is. So every cell in our body has a receptor for vitamin D. And that tells you how important vitamin D is because every cell needs it to do the work
Yes.
it needs to do. But receptors can become resistant, including vitamin D receptors. Now, the classic one people hear about is insulin resistance,
Mhm.
where this drives diabetes because receptors on the cells, every cell has one, can become resistant to insulin. You can have all the insulin in the world. It can't find a place to attach. It's almost like you don't have insulin, blood sugar goes up, diabetes. Well, vitamin D receptors, every cell in the body, but researchers out of University of Illinois, Chicago back in about 2018 said, oh my gosh, there are more vitamin D receptors in the gut than any other body part. So vitamin D must be even more important for the gut than any other body part. But the vitamin D receptors in the gut can become resistant to vitamin D.
Hmm.
And if we fix that, we can fix the gut in a way that the original literature that they shared was it can reverse autoimmune disease of the gut, ulcerative colitis and Crohn's disease, the inflammatory bowel diseases, but also these really hard to get rid of chronic infections like H. pylori and C. diff that just do a terrible number on the gut. You can
Yeah.
get rid of these recurrent infections. But it looks like this fixes the gut in the way that can allow us to fix everything. And so how they fixed it was with what I call the foundational triad: vitamin D supplement every day, probiotic every day, butyrate every day. So most people heard the vitamin D, the probiotics, but maybe not so much the butyrate that we got a
Great.
chance to talk about that I'm so high on,
Mhm.
right? So good bacteria go up, bad bacteria come down. The lining of the gut will stop making inflammation that is hurting itself. So this is where you hear things like the gut has become this engine of inflammation. It's actually making its
Mhm.
own inflammation.
Mhm.
So 6 months later, they came out with a second study that go, well, geez, you fixed the vitamin D receptor resistance with the foundational triad. It is and I'm quoting the part of the title of the scientific article, a nuclear weapon against metabolic syndrome,
Mm.
diabetes, obesity, and cholesterol issues. And we
Mhm.
have 2/3 of us Americans are pre-diabetic. So this
Mhm.
nuclear weapon they don't know about. Wow, it's a big one. But then 2 years later, Harvard Journal of Psychiatry comes out. You like Harvard, Harvard researchers, they do so much cool research.
Mhm.
Now, I tend to find they do the research, but not a lot of people, including within Harvard, use that research therapeutically in clinical
Yeah.
practice. Okay, I think it kind of gets missed for decades, right?
Mhm.
And so they did this research and said, well, if you can fix the gut this way, and the classic way that they described is, well, you fix the vitamin D receptors, including a really important good bacteria that people are starting to hear about. I don't use this as a probiotic, even though it's now available, because
Mhm.
this, by fixing this vitamin D receptor resistance with the foundational triad, will fix it on its own. A species of good bacteria called Akkermansia muciniphila will go up. So
Mm.
I don't use that new probiotic, pretty expensive, because you'll make it on your own by fixing this.
Yeah.
So Harvard Journal of Psychiatry says, hey, if you fix the gut like this, it treats major depressive disorder.
Mm.
And we go, well, that kind of makes sense, gut brain connection, right? Well, then
Mhm.
another psych journal about a year later goes, hey, if you fix the gut this way, it changes personality traits. People become more outgoing and more social.
Mm.
And then I just did a whole series of videos last fall for Breast Cancer Awareness Month. Breast early detection is not the key, prevention is the key.
Mhm.
But if the few people, we could probably prevent 95% of all breast cancer, and the few people that slip through the cracks, early detection
Mhm.
is really helpful.
Mhm.
Um,
Mhm.
but they talk about if you fix the gut this way. Now, the article didn't mention vitamin D receptors, but they say, well, if you do vitamin D probiotic and butyrate, you will prevent breast cancer because there's bad bugs in the gut. One particularly called Coxsackie B, like in boy B3, will translocate through a disrupted leaky gut into the bloodstream, go to the breast tissue, whack the breast tissue microbiome, thus the intestinal microbiome breast axis, driving breast cancer. Now, I already knew that Coxsackie B4 will translocate from the gut, the bloodstream, go to the pancreas and cause type 1 diabetes. B4, Coxsackie B4, type 1 diabetes, Coxsackie B3, breast cancer. And so, here's all these intestinal microbiome, axes, intestinal microbiome, brain, breast, bone, pancreatic beta islet cell, all this kind of stuff. And so, truly, this foundational triad will fix the gut in the way that will fix everything.
Mm. That is so
And
powerful.
I
Yes.
like the brain connection. I thought that was really hip, that part of
Yeah.
this connection thing, but it's really connected to all cancers and autoimmune disease and all this kind of stuff. So I think if you don't know where else to start, you might have started with some vitamin D already. You might have started
Mhm.
with some probiotics already, but you probably haven't combined it with butyrate.
Butyrate.
But
Yeah.
then because you build up the good bacteria, well, now you're making the butyrate on your own, right? So you don't need that
Yeah.
forever.
Yeah.
You build up all the good. You probably don't need the probiotic forever.
Correct.
Now, we're really bad at making vitamin D from sun exposure. Even here I am. We're just bad for a variety of reasons. You better keep taking your vitamin D every day. And please, maybe after 8 weeks of using a certain dose, get your blood drawn. And if you're
Mhm.
not 90 to 100, for every 10 points you want to go up, increase your daily dose by 1,000 IU per
Right.
day. If you overshot, and truly, when I see people that we got to reverse chronic disease, I'd rather overshoot than undershoot, because even though undershooting, people go, oh, you got to be careful. It's like, no. Prescription meds, you got to be careful if you overshoot, but not naturally occurring things that are already in the body. The body's like, well, I already seen that my whole life. I'm not going to freak out if you give it to me. I'm not going to freak out if I have a little more than I need.
Mm.
But you give me that prescription medicine that I've never seen, that
Mm.
because I've never seen, I kind of think it's a toxic thing. Well, then I'm going to freak out if you give me too much
Yeah.
of that I've
Yeah.
never seen before.
Yeah, and I mean, you bring up a great point, right? Because you mentioned all these like metabolic syndromes, right? And I think if you're in the brain world, especially if you're not a provider in the brain world, you're thinking, well, what does this have to do with me? And I think we're beginning to understand that so many, if not everything, mental health related, is metabolically driven, and vice versa. And so you're saying with this foundational triad, it doesn't matter the symptomology you present with as much as it's let's just focus on these three things. Let's get your vitamin D where it needs to be. Let's get your gut bacteria where it needs to be. Let's get this butyrate on board and see if some of these genes will start to turn off, with the
Yep.
goal that healing can occur rather than going, right at the, right downstream, focusing on the stuff that's at the end of the road. Let's focus on this thing that could be triggering it, at the foundational level. I think that's so cool. Outside of that, so you do the foundational triad. Anything else that people need to be thinking about from helping? It sounds like meditation. We talk about that a lot here too. Is very, very important. Even if you don't like it, just try to set in some silence and do some deep breathing. That's really, really important. What else would you say is important for someone wanting to make their genes well, or even for a parent who's trying to help their kids with the gene health?
Yeah, you touched on something really good there, Josh, if I can say that. So I
Yeah.
mentioned butyrate works almost exclusively through epigenetics, and I
Yeah.
mentioned how important vitamin D receptors are. Okay. So what happens when vitamin D attaches to vitamin D receptors that are now awake is vitamin D receptors produce a protein called vitamin D responsive element. This guy goes to other genes to turn on and off other genes, such that every gene that predisposes to autism and every gene that predisposes to type 1 diabetes will be turned off with this vitamin D receptor thing, because now vitamin D responsive element goes there, turns off every gene that predisposes to autism, every gene that predisposes to type 1 diabetes. And so many genes are vitamin D responsive genes. So, I mean, it just hits so many different levels for this kind of thing. It is just like remarkable thing. So thank you for mentioning that epigenetic connection. So, if you just sit, take 3 deep breaths, you go, what's that going to do? Well, Harvard says it'll do a lot. Right now, for people, when I used to live near downtown Chicago, I'd say every time you get stuck at a stoplight, just do 3 deep breaths. By the time they got the office, they'd have like 20 deep breaths in, right? Or 20 times that. Where I live nowadays, not as quite as many red lights, but a little bit goes a long way with that kind of stuff. And truly, the brain is good, always get dragged into the mess. No matter what is creating a problem, the brain always gets dragged into the mess. I was kind of saying that the brain sort of sits up there and goes, "Hey, body, don't drag me into your mess." I'm the brain. I don't. I got stuff to do here. It is always going to get dragged into the mess. And so, invariably, when people have a chronic health issue of whatever etiology, whatever kind, the brain's always going to be affected. But then when you fix whatever that stuff is, the brain's always going to be a lot happier with you fixing the thing that's kind of, dragging into this big old mess.
Mhm. Yeah, and within that, you're just calming so much down, and so I think, if you're struggling right now or you're not feeling well and you're just trying to say, like, "Where do I even start?" Or maybe I've been in this for years on end and nothing's working. If you haven't done those 3 things you just talked about, and I would say most of the human beings that I've worked with have not tried butyrate, right? That's just not something that's very widely out there. Try those 3 things together, and I think that's really powerful in what you may see happen from that. And then from there, like you said, just doing things to help your body heal. Any other supplements you recommend or, protocols you recommend just to keep these genes healthy?
Yeah, so because we live in such a stressful world, in anybody who's like a mid-teenager or older, we always know that cortisol, the stress hormone's gotten stuck in the stress mode. Now, of course, emotional stress could be dramatic and daily and constant. It kick cortisol up and get it stuck in the stress
Mhm.
mode. But also all these other things like a gut disruption, a vitamin deficiency, a toxicity thing, all these other things are physical stress.
Mhm.
And to the body, stress is stress. Doesn't matter if it's physical, emotional, spiritual, it's just all stress. Well, the body's fight or flight mode, life or death mode, stress mode is designed to deal with intermittent stress. It's kind of come and go stuff. It kicks up and then it comes down, kicks up. Terrible day at work. Now it's quiet. Kids drive me crazy. Now they're the sweetest thing in the world. Spouse drive me crazy. Now I really do love that person. Up and down, up and down. But with this physical stuff that we're talking about, it kicks cortisol up in the stress mode. But because the physical stuff, like a disrupted gut, is 24/7, week after week, month after month, it kicks it up and gets it stuck. And so what we're talking about is we got to get rid of these things that are causing physical stress. Okay. And then cortisol's in a position to reset itself. But doing some deep breathing, this meditation is cool because you're kind of teaching the body what calm feels like again. The body has forgotten what calm feels like. And so we're like, okay, now we got rid of these dudes. Get in that
Mhm.
calm mode. And your body's like, what is this calm mode you're talking about? We're like, well, calm. And the body's like, I have no idea. I've been like this for like 30 years, right? 20 years. It's like, I have no clue you're talking about. I go, oh, okay. You got to teach it what calm feels like again. This is
Mhm.
the deep breathing stuff. But a lot of people will do that and still can't get where they're going because they haven't gotten rid of some of this physical stuff. But also, this is where you see the benefit of adrenal adaptogens, things like rhodiola and cordyceps and ashwagandha, and these kind of things that will help cortisol find that calm again. Now,
Yeah.
a mid-teenager or younger, children are so great at healing, including juvenile rheumatoid arthritis, it's autism spectrum disorder, any childhood stuff. They're great at healing. You get rid of these physical stressors, their body's like, oh, I can take care of this. But including they're going to be stuck in the stress mode, maybe because of adverse childhood events, all this other kind of stuff. But then a mid-teenager and older, you really got to use these adrenal adaptogens. So I like one. I think it says a lot. It's the one I use called cortisol level reset. And it doesn't have ashwagandha. And the reason it doesn't is really specific is I find a lot of people with pretty significant chronic health issues. And the people I see tend to be quite complicated. A lot of them have been other places, seen other people by the time I see them, is their gut is so messed up that fairly commonly ashwagandha will actually bug people's gut.
Mhm.
And so I just kind of got to the point where, well, if I'm going to use an adrenal adaptogen, I'm going to have to figure out one that doesn't have ashwagandha, but all this other stuff, because I don't need anything that's going to create more gut issues when I'm trying to fix this gut. It's such a central
Mhm.
mechanism for all. So that's kind of why I use that specific one. But I also like one, a plant-based amino acid called L-theanine
Mhm.
that creates calm, super safe. You can use it during pregnancy. You can use buckets full and no side effects, and it creates calm. And anything you do to create calm helps the body fix everything, right? If you can find some calm, cortisol kind of does a big, oh, yeah, I like what you're
Mhm.
doing. You got to fix everything.
Right.
And so you can use it, including for sleep. Most sleep meds that people get put on improve sleep quantity, more sleep, but they actually adversely affect sleep quality. And
Mm.
what you really want is
Mhm.
quality and quantity. And so here's this L-theanine creates calm. So it's going to help you sleep, including you wake up in the middle of the night, can't get back to sleep because your brain's running or whatever.
Mhm.
You can't take another sleep medicine, even melatonin, because you're gonna be foggy in the morning. But L-theanine is great because it doesn't cause sleep. It causes calm. And if you're calm, you should be able to get back to sleep.
Mhm.
Right. And so I love L-theanine. I use it an absolute ton for this kind of stuff, including a lot of people get put on trazodone, which actually
Mhm.
is one of the few prescription medicines that actually improves quantity and quality of sleep.
Mhm.
But a couple of years ago, studies came out that increases risk of dementia and Alzheimer's. It has a negative impact on the brain.
Mhm.
And so I try to get people off that med, even though I go, well, geez, that's a great prescription med if you want quality and quantity, but we can't let you on it forever because it's going to kind
Mhm.
of mess up the brain in the long haul.
Man, that's it's such a powerful thing to think about too. So many times when people are unwell, or even as providers and we're trying to help people, you're engaging in numerous different concepts, right? Whether it's, let's just call it all medicine or plant-based medicine or whatever that is. And what you're saying is that if that foundational triad's not good, it doesn't matter what you're doing because ultimately maybe your gut can't handle it. Maybe your gut can't absorb it. There's all these other things that are happening. So if you're, maybe you went out and you took one of these supplements, right? One, did you get a real supplement? But two, or herb or whatever, but two, does your body at the moment have the ability to even consume this to work? And so I love the concept of that focus with that foundational triad. And then if you're not working well, moving over to some of these other like adaptogens, these neurotropics, these cortisol driven things, all the things that you're talking about, because that then gives you the opportunity to create even more healing and get off other stuff. And I think
Yeah.
that's really important for people to hear because I don't know how many people I work with who maybe we bring up an adaptogen. They're like, oh, I took that, got it at Walmart one day. And it's like, well, one, it's probably not the same thing. But two, now that you're talking about this, was their gut even able to handle that? Did they
Right.
even absorb it?
Yep.
And was it doing where it needed to go? So Man, I think that is so powerful, David. You know, with the stuff you're doing, I mean, we could spend hours talking about this. So we definitely, you're going to be back here, right? We're going to talk about this more. I know we barely touched the surface of all these things, and
And we
I
didn't,
think it's
Josh, we didn't even
really,
get a chance to talk about how sunlight
yeah, right, yeah.
impacts brain parts like the amygdala that oversees emotions, the perihabenula that's mood, that impacts the intestinal microbiome, including how you can use sun to build up the butyrate producing good bacteria in your gut, how it resets the HPA
Mm,
axis, even in during pregnancy for the developing fetus.
and
Hopefully,
that's
I'm sending a little stuff like, ooh, we got some other topics here.
yeah, yeah, we definitely got yeah, and I think it's important to say that too because you know what we're seeing, and correct me if I'm wrong, you know, with the amygdala and all these other things, it's more than just vitamin D for sunlight. There's a gamut of things that it's
Yeah.
doing in the brain and the body. So many
So
times people are like, "Well, I'll just go take my vitamin D supplement and I'm good." No, you know, sun is doing way more than some vitamin D, right?
yeah, it is fascinating stuff. I got a chance to, and my wife, who I shared with Josh before we went on, that my wife is a licensed clinical social worker, psychotherapist. And so she and I talk a lot together. And so we were in Paris in the summer of 2024, and we talked about the 4 maternal microbiomes during pregnancy that determine the development of the fetal microbiomes before the child's even born. What
Mhm.
throws it off, how to correct it, the implications if you don't correct it, the implications if you do, including that 3 months through the pregnancy, early in the second trimester, baby's eyes actually see light coming through the abdominal and uterine wall. And it starts helping with all this brain formation of the how the body deals with stress, the HPA axis, the fetal intestinal microbiome before they've been born. And so I'd love to talk about that at some length and teach people teach them how to use that because it is such cool science, super geeky sciencey, and I'm a super geeky science guy, so I love this stuff.
Yes, we are definitely doing this. Yes, I love this discussion, man. David, thank you so much. I know as people are probably listening to this, their heads probably spinning, and I know even for me a little bit, my head's kind of spinning of like, oh my gosh, there's so many things I can do with this. And so I think you know if something seemed really overwhelming, or you didn't understand it, go back, check it out, re-listen to it, reach out to me. You can reach out to David, right? David, how can people like get in contact with you to learn more about this stuff or read some of these resources that you're producing?
Sure. So my website is drdavidbilstrom.com. And we have educational programs for medical people. We have educational programs for non-medical people. There are tons of blogs I've written about this stuff, including a blog about TUDCA, multiple blogs about the vitamin D receptor thing. I got over 150 YouTube videos, and I am always, always, always stressing that this is the science. This is not somebody's opinion. This is the science. So if you're going to see me on a YouTube video, I'm probably going, and this scientific article says this, because I think it's important people
Mhm.
understand that this is truly the science.
Yeah.
Now, it might not be the science that a lot of the more traditional Western allopathic docs know.
Mhm.
Not everybody can know everything. They probably know how to use meds and what the side
Mhm.
effects are, and that's what you want if you're going to use prescription meds, but they don't know kind of this kind of stuff. But I would
Yeah.
like to share this with people so that you know it, and then you can make hopefully some very good decisions about your health, your children's health.
Absolutely, and we'll post these links in our show notes as well. So if you're like listening on YouTube or you know watching on YouTube, or listening on all the different platforms, just go down. You'll kind of see that there. And then yeah, man. Oh, so good, David. Thank you so much, man. Well, I'm so grateful. Anything that you kind of want to leave out with? I know you work outside now. You have the tan line problem and all the things. What's kind of the one
On
thing
my feet, on my foot.
on your feet? Yeah, on your
My feet,
feet.
because I'm
Yeah.
wearing pants. It's not a tan line thing. I'm actually wearing pants. But Josh and I shared that I actually have a flip flop tan line on my feet
Oh,
from my clinical work. How many docs can say they got a tan lines on their feet from their office work, right?
I
And so
love
I
it.
try to use that stuff too. But I just say, don't let anybody ever tell you that we don't know why you got this chronic health issue. And don't
Yeah.
let anybody tell you we don't know how to make it go away. A
Mm,
lot of people are told that. Well, we don't know why you got this, and there's no way to make it go away, and you're stuck with it. And the only option you have is this medicine that won't really fix the problem, but it'll kind of make you feel better temporarily, but it'll probably get worse over time. just know the body is way too smart to not be able to fix anything you got, or to prevent, with a little help, prevent stuff you don't want.
Mm, powerful. Thank you, David.
Thanks, Josh, for having me. It's been my pleasure.